Okay, guys, so today we will be discussing CPR or cardiopulmonary resuscitation from the point of view if the clinical scenarios are going to be presented to us in some OSCE exam. Scenario 1. You enter your office and see that your nurse or colleague or your receptionist is lying on the floor and looks that if he or she is unconscious. So, what will you do? First of all, establish the unconsciousness by calling them. If no response, then immediately call EMS services and meanwhile you start the CPR. Well, spell CAB. Previously, we were using the mnemonics of ABC, but now American Heart Association has changed the sequence and they say we have to firstly check for the circulation. To restore the blood circulation, start with chest compression. Put the person on their back on a firm surface. Place the heel of one hand over the center of the person's chest. Place your other hand on top of the first hand, like this. And use your upper body weight and compress the chest at least 2 to 2.5 inches or 5 to 6 centimeters. Push hard and fast at a rate of about 100 to 120 compressions a minute to restore the circulation. Then comes the airway. Clear the airway, open the person's airway using the head tilt chin lift maneuver this way and jaw thrust. This is how you will be doing head tilt and chin lift and jaw thrust. If they will be providing you in your exam a mannequin, so this would be the position of the mannequin. Check for normal breathing, look for chest rise, listen for normal breath sounds, and feel for the person's breath on your cheek. If the person is not breathing normally, then you start mouth to mouth breathing. We call it rescue breathing, and it can be mouth to mouth breathing or mouth to nose breathing. If you are doing mouth to mouth breathing, always pinch the nose while performing the mouth to mouth breathing. And the position should be head tilt chin lift. Rescue breathing. When someone is not able to breathe on their own, they still need oxygen to survive, so air has to manually be put into their lungs. This can be done with a machine such as a ventilator or respirator. But definitely your dental practices are mostly not inside the hospital and you don't have the respirator or you don't have the ventilator. Most commonly what we have is our oxygen cylinder and the mask. That's it. So to start with, we have to do it mouth to mouth breathing. American Heart Association also released the guidelines for what we call the hands-only CPR, in which the rescuer, they only provide chest compressions and no supplemental breathing. The release of this technique is, well, few people think that probably now mouth-to-mouth breathing is no more required. But actually that is not correct. This technique is only cleared due to two reasons. Studies showed that if carried out within the first few moments of an out-of-hospital event of cardiac arrest, so the hands-only CPR is effective for the adult victims. No training is required. People often panic or feel helpless during a cardiac emergency, but hands-on CPR only requires a bystander to call EMS, then provide hard, quick compressions in the center of the chest to the tune of staying alive. Rescue breathing concerns. Due to COVID-19, many people are concerned about providing mouth-to-mouth resuscitation, and that is quite understandable. One way to prevent transmission is through a rubber single-way mask that is found in most of the first aid kits. It fits snugly over the victim and the rescuer breathes into a valve which delivers air into the victim's lungs while minimizing exposure to any germs. Make sure these masks are available with your organization's AED or first aid kit. Or if it is your own practice, then it should be available in your first aid kit. Additionally, hands-on CPR is available, which we have already discussed, life-saving option for most victims and minimizes the spread also. CPR cycle. 30 chest compressions followed by 2 rescue breaths is considered one cycle. Or we can say one cycle is 30:2. Continue the CPR until 5 cycles are completed. If the person has not begun moving after 5 cycles, then administer one shock by using the automated external defibrillator or AED device. This is how the electrodes of the AED are placed. And when you are giving the shock, don't touch the person. Stay away from the person. Continue the CPR until there are signs of movement or emergency medical personnel, they take over. Scenario 2A is you enter your office or surgery where a person is collapsed and your nurse is already doing the CRP. So how will you join it and how will it become a 2-responder CPR now? Responder 1 would be performing the chest compressions already, and responder 2 will start preparing AED or barrier devices, BVM, with the supplemental oxygen if that is available in your practice. So this would be the protocol. Responder 1 will be giving 30 compressions at a rate of at least 100 per minute. Responder 2 maintains airway, then position and seal mask. Responder 1 gives 2 ventilations, each lasting 1 second until chest starts to rise. Repeat the cycle of compressions and ventilations at a rate of 32 for an adult or 15 for a child or baby. Responder at head periodically checks for the effectiveness of the compressions by checking the carotid pulse. Responders switch roles between the cycles, continue CPR until AED can be applied or more advanced care takes over or local protocol dictates otherwise. Well, for the AED, always follow the prompts. For the baby or infant, well, check the infant pulse that is stronger in the apical area or left part of the chest near the heart. You can choose any of the two in taking an infant's pulse. Well, it is also strong in the brachial area or inner band of the arm at the back of the elbow. Another place to check the baby's pulse. CPR in children. To avoid compressing the stomach, find the point where the lowest ribs join in the middle and then 1 finger's width above that compress the breastbone. Push down 4 centimeter for baby or infant or 5 centimeter for a child, which is approximately 1/3 of the chest diameter. Release the pressure, then rapidly repeat at a rate of about 100 to 120 compressions a minute. After 30 compressions, tilt the head, lift the chin, and give 2 effective breaths. Continue compressions and breaths in a ratio of 2 breaths for every 30 compressions. Although the rate of compressions will be 100 to 120 a minute, the actual number delivered will be fewer because of the pauses to give breaths. The best method for compression varies slightly between infants and children. Chest compression in babies who are less than 1 year. Do the compressions on the breastbone with the tips 2 fingers, not the whole hand or with 2 hands. The quality or depth of the chest compressions is very important. If the depth of 4 centimeter cannot be achieved with the tips of 2 fingers, then you can use the heel of 1 hand. And now look at this advice for the children. Chest compression in children who are above 1 year. Place the heel of 1 hand over the lower third of the breastbone as described above. Lift the fingers to ensure pressure is not applied over the ribs. Position yourself vertically above the chest and with your arm straight, compress the breastbone so you push it down 5 centimeter, which is approximately one third of the chest diameter. The quality, that is depth of the chest compressions, is very important. In large children, or if you are small, this may be done more easily by using both hands with the fingers interlocked, avoiding pressure on the ribs. What are the indications for CPR? A person might need CPR if they stop breathing in any of these circumstances, like a cardiac arrest or a heart attack, choking, a road traffic accident, or if they are about to drown and you rescued them, suffocation, poisoning, a drug or alcohol overdose, smoke inhalation, electrocution, suspected sudden infant death syndrome. So for adult, this is how we place our hands for the compression. For a child and for infant. Rescue breaths: open airways by lifting the chin slightly, watch for chest rising, pinch nose and give 2 rescue breaths. Certain points to remember: use CPR when an adult is not breathing at all. For a child or infant, use CPR when they are not breathing normally. Always use CPR if the adult or child is not responding when you talk to them or tap them. If someone is not breathing, giving CPR can ensure that oxygen-rich blood reaches the brain. This is important as without oxygen, someone can sustain permanent brain damage or they may die if it is not done within 8 minutes. So over here we are done with our today's lecture.